I'm really pleased to be able to open and welcome you all to our webinar today on exploring the forefront of digital visualization platforms with a focus on women, children, adolescents, and health. We will be introducing to you today 3 different digital platforms that you can use to explore different types of data on women, children, and adolescent health. The first will be the new IA 2030 scorecard. That will be followed by a presentation on the Global Financing Facility Data Portal. And then we will hear from UNICEF on the Countdown to 2030 profiles. After you are exposed to all of these different platforms, we will turn this over to Dr. Helen from Kenya to give us her reflections on the utility of these kinds of platforms for country use. And then we will open it up to all of you for question and answers. And we'll be really looking forward to hearing the thoughts that you have on these platforms. Then we will wrap up with some closing remarks. And that is our program for today. Also, there is you should be able to see on your screen a Q&A function. So as we progress through the agenda, feel free to put in any questions that you might have for the panelists who can answer in real time. And then also we will try and address them during the question and answer session. So with that, I would like to first start us off. Well, first I should introduce myself. I'm Jennifer Hekeisho, and I'm currently a senior advisor at the Global Financing Facility for Women, Children, and Adolescent Health. I am also a senior scientist at the Johns Hopkins Bloomberg School of Public Health, and have had the lucky experience of being able to work on some of these platforms in the past. So I'm very excited to be here with you all, and looking forward to hearing your thoughts as well. So I would like to turn us over now to our first presenter, that is Ms. Rose Weeks. She is currently a research associate at the International Vaccine Access Center at Johns Hopkins University. She is working on the translation of science to practice in the IVAC Center at Johns Hopkins. And she is an expert in qualitative and implementation science research, and is here with us today to present to you all the IA 2030 scorecard. So with that, I'd like to hand it over to you, Rose. Please go ahead.
Thanks so much, Jennifer. It's nice to be with everyone today. Good morning, good afternoon, and good evening, depending on where in the world you are. Next slide, please. I'll be speaking about the Immunization Agenda 2030 scorecard and the use of such visualization programs for increasing data-driven decision-making. And I'm speaking on behalf of the Momentum Country and Global Leadership Initiative that is supported by USAID. Next slide. First, we'll do a quiz for those on the line. How many zero-dose children were there globally in 2022? And I believe there's a poll associated with this. The second question is, in 2022, what proportion of countries had legislation in support of immunization as a public good? So the options for the first one are 70 million, 14.3 million, or 8.5 billion zero-dose children. And the options for the second are 20% of countries, 43% of countries, or 59% of countries. Tanya, Andrew, should we give it a few more seconds or maybe reveal the answers? Yeah, let's see how people voted. All right, I think we didn't get too many votes in just yet. I think I might have jumped the gun a little bit, but it did. Can you go to advance to the next slide, Andrew, so we can see? Sorry, I don't. Maybe you could leave the. Okay, sorry. I thought we could leave the poll questions up. Okay, good. So it looks like the majority of those on the webinar know that there were 14.3 million children who never got 1 dose of DTP in 2022. And but we didn't get anyone to select the right answer, or maybe just one participant that 59% of countries have legislation in support of immunization as a public good. And so, of course, that helps to sustain financing and other important elements of immunization programs. And all of these all of these facts are available instantly on the Immunization Agenda 2030 scorecard. So we just encourage participants to click through the QR code, use the short link, and bookmark this link so that you can try the scorecard as we are running through the different features of this tool. Next slide, please. The Immunization Agenda 2030 is an ambitious global strategy to maximize the life-saving impact of vaccines that, if fully implemented, will save 50 million lives over the next decade. IA 2030 seeks to create a world in which everyone, everywhere, at every age, fully benefits from vaccines for good health and well-being, and is underlined by a framework for action that was implemented in 2020 and enacted by all WHO member states at the World Health Assembly. Next slide, please. The framework for action that was shown on the previous slide has several core operational elements. There are 4 operational elements that are integrated to empower and drive actions to advance the implementation of IA 2030. And the scorecard really speaks to the last 3. So monitoring and evaluation, all of the indicator performance metrics are shown on the scorecard. Ownership and accountability, the idea is to really increase these measures by making the data highly visible and very accessible to anyone in the world at any time, and communication and advocacy. So of course, using visuals are a way to increase the understandability of complex data for various diverse audiences. And we really see the scorecard in that way as being part of the visual analytics movement, again, which looks at ways to make data highly interactive and accessible in visual digital platforms like the scorecard. Next slide. This, again, our mission, sort of more specifically, is to focus attention, track progress against 18 of the indicators from the IA 2030, the impact goals and strategic priorities, inform the World Health Assembly, and serve as a tool for monitoring, accountability, and advocacy. And just to note that the number 18 indicators is not quite the same as what's in the framework for action. Some of the indicators are still in pilot development, so we are currently visualizing 18 of the indicators. Next slide. This is a bit more about how we think about the scorecard and the audiences, which I know is a sort of an important theme we wanted to emphasize with this webinar event. We see the scorecard as really supporting the high-level decision makers that are sort of pictured with a view pictured at left, where you can see sort of an airplane window. We're really looking at the 30,000-foot view of immunization programs through the scorecard. We're not able to see subnational data, but we're really hoping this tool is what is needed for high-level decision making. But again, it's not sort of getting into the nitty-gritty of the day-to-day performance, and it's only updated annually. So it is meant to be clear and comprehensive for very busy and high-level decision makers. The second element of what we see as a portfolio of analytic products that are coming from the framework for action are the analytic dashboards that are in development now. And so this is being driven by WHO with input from the regions that WHO supports. This will be a programmatic deep dive into performance with expert level crosstab filtering and data downloads. And then the final part of the sort of the family of narrative products coming from the framework for action is in-depth narratives exploring data findings such as performance in middle income countries, and that we've started to release reports that really dive deep into certain variables that are illuminated through the data, the rich data that's being collected by countries and regions in support of the IA 2030 and what that tells us about vaccine equity globally. Next slide. As an example of narrative products that are in development, we are producing a series of country briefs for agenda setting purposes. And these are, we're aspiring to have these be used during the EPI at 50 celebrations, which are in 2024. We're very excited to make these very highly visual products, but brief and sort of custom made for policymakers, available as the 50th year of the immunization program kicks off in 2024. And we'll be sort of piloting this process of developing country reports that have this very 360-degree view of immunization system performance using all the indicators that are collected on the scorecard in a select number of countries that are low and middle income settings, with either high numbers of zero-dose children or otherwise prioritized for program support and advocacy purposes. Those countries are listed here. But again, if we see a lot of uptake of the product in the first year, we could produce the briefs for all countries in subsequent years. Next slide. And with this, I will do a demo for you all. So I'll be sharing my screen so you can see how the scorecard works. And I believe should be sharing now. All right, so this is the Immunization Agenda 2030 Scorecard Overview Dashboard. On this page, you can see at a glance if each of the 18 indicators tracked by the scorecard is on track toward the 2030 target, and that's really for the impact goals, off track toward the target, or if there was no change. And this this is pertaining to the impact goals, which are listed here. So we can see at a glance that we are off track for preventing 50 million future deaths. And this is, of course, due to the enormous toll that the pandemic took on immunization systems globally. We see that we, at the moment, I don't think this one has a target tracked on this page, but you can see at a glance that most of the countries have achieved polio eradication targets, whereas only 83 countries have achieved measles elimination targets. And here we can see most of the antigens tracked with this indicator are off track toward the 90% coverage target. Sorry, this is actually outbreaks. Excuse me. This indicator shows that we've had more outbreaks of polio and cholera than in the baseline year, but the measles is falling below the threshold that was set in the baseline year. So that is probably because there were a lot of measles outbreaks prior to that baseline year. But that's quite a complicated indicator because there's a lot of different antigens included. This one is the one I was starting to discuss that shows coverage level. So this is DTP coverage is off track toward 90%, although it has recovered substantially since 2021. Pneumococcal conjugate vaccine final dose is the only indicator here that is shown to be on track toward reaching 90% coverage. There was a big jump from the previous year that you can see when you go into exploring the data. So this is sort of what we see on what we call these cardinal pages that we can really get a lot of information on one page. And I wanted to show how the new filters work. There was a recent attempt to make this a lot more usable for our colleagues working in the UNICEF program regions. And so you can now sort this by UNICEF program region. So we can see how this looks in coverage looks in, let's see, the South Asian region. So we can see here how performance dropped during the pandemic years and is coming up now substantially for some of the antigens, but remains very low for HPV final dose. We can also now sort the coverage in all under indicators by the World Bank income classification. So we can see how these indicators look for low middle income countries. And there's a lot of interesting disparities from one income group to another. So we can see the low and middle income countries also have yet to introduce HPV for, in most of the cases, more likely to be using PCV3. But when you go to the upper middle income countries, actually the coverage for PCV is lower in the upper middle income countries. So there's just really interesting things that you can explore using these different sorting filters. The strategic priorities are listed under this icon here. And one thing to flag is the indicator that we mentioned earlier, the proportion of countries with legislation in place of immunization, in support of immunization as a public good. So you can see at a glance, a very, very clear sense that this is increasing. So that's a really promising trend. I will also share how the country page works because that's really exciting. means for countries to compare their performance against either the region or another country. So this view is a way for countries to see. It's almost like a report card of how the indicators look for their country against the region. For all of the indicators tracked by IA 2030 scorecard. And then you can also compare against another country. So I'll compare against Rwanda here. And we can see how the coverage looks different from one country to another. They're both very, very high performing health systems, but one hasn't introduced HPV. I think that's Ghana hasn't introduced HPV, whereas Rwanda has reached 75% coverage. And then also with the indicator we discussed earlier, legislation in place that is supportive of immunization as a public good, we can see that Ghana has implemented this legislation, but Rwanda hasn't. And so the idea here is to highlight what's going well, but also potentially incentivize some competitive or constructive competition against countries that are benchmark countries for performance in each region. So those are some of the things we wanted to share. I did want to show earlier the page I was on, which was the I actually haven't shown, this is the number of zero-dose children globally. So this is a new feature, just wanted to share how this looks. We have an 11% increase in the number since the baseline year of zero-dose children. So that's definitely the wrong direction. We want to be reaching a 50% reduction by 2030 as set in the impact goals in the framework for action. So that's very, very concerning, but there has been a substantial amount of progress since 2021. Okay, I think I'm almost out of time. I think I might be out of time right now. So I'll just say, like, the last thing I wanted to say is you can download the chart by clicking there, and then you can use that to populate your presentations for your audiences. I will stop sharing. I believe, Andrew, there was one more slide I think I had in my slide set that I just wanted to quickly share before we move on to the next presenter. Can you go up to the website traffic? I just wanted to show one more. Yeah, that. So we were really excited that the scorecard has had an increase in website traffic in the past 6 months, but we're still seeing most of the traffic coming from high-income countries. So we were hoping to work more to disseminate the resource in low and middle-income settings so it can be used as a tool for decision-making. Thanks very much.
Great. Thank you so much, Rose, for that excellent overview of the IA 2030 data portal. Really appreciate all of the types of features that are available, the global indicators, the ability to examine progress at regional level, and then that the ability to look at countries and the compare function are really very useful kinds of features, and also the ability to download charts for people to use in their own presentations is a wonderful addition. So thank you very much. I would now like to move us along to the second presentation, which will be on the GFF data portal. I have the pleasure of introducing Ms. Jessica Brown, who is currently a research associate at Johns Hopkins University. She is currently supporting monitoring and action for gender and equity, or the MAGE project as it's called. She is a gender and M&E specialist at the moment, and she's focusing on supporting countries to improve measures of gender equity in health. Before joining the MAGE project, Jess was a results specialist at the World Bank working on the development of the GFF data portal. So she is best placed to introduce this to you all. So with that, I'd like to hand it over to Jess. Please take it away. Thank you so much.
Thank you so much, Jennifer. Hi, my name is Jess. It's very, very nice to meet you all. As Jennifer said, I'll be presenting on the GFF data portal, and I have a couple slides, and then we'll jump into a demo of the portal. So first and foremost, I'm just going to introduce a little bit about the GFF and the portal overall. So the GFF actually focuses on reproductive, maternal, neonatal, child, and adolescent health and nutrition. So it's actually a cross-cutting program that goes across several key health areas. So this is not a space where there's a deep dive into any single vertical program like immunization, HIV, family planning. The GFF focuses on each country's investment case or national plan, World Bank project, really specifically to improve RMN-CHN. So the GFF partners with 36 countries on developing out those plans for improving RMN-CHN, and then working with the country to improve measures of health financing, universal health coverage, health system strengthening, data and measurement around this area to help the country achieve their goals for improving RMN-CHN. And in partnership with the World Bank, of course, we also include measures from the World Bank indicators and projects, so the DLIs, where appropriate for certain countries. So the GFF partners with the World Bank in the countries to really strengthen that partnership and collectively works to improve RMN-CHN. So how does the portal play into this? So the GFF's objectives were to develop a public dashboard, first and foremost, a space where anyone from the country partners to development partners, civil society, academia, or others could go to find relevant information related to all of these areas. Instead of going to multiple different other portals for vertical programs, they could find everything needed about the country's program and RMN-CHN in one space. And the next idea is to provide secure, well-managed storage for the data across all components of the GFF. Oh, I'm sorry, Andrew, could you go back to the direct? Thank you so much. And so for this, because we're collecting and reporting as the GFF data across all countries, it was very important to have one place to manage all of that data across the model and to streamline all of the reporting into one area. Because the GFF's data collection and visualization is very country specific, we needed one single system, and the data portal seeks to accomplish both the storage and then the visualization of all of that data. Thanks, Andrew. Next slide, please. So while each country does have its own set of indicators, the GFF also has one theory of change that identifies various benchmarks that partner countries should be hitting based on how long they've been implementing. So all countries, for example, need to have completed an investment case as part of their partnership with the GFF, have a country platform that together provides governance for decision-making around RMN-CHN priorities, and have identified health financing and health systems reforms. And then as countries go along in their process of the partnership with the GFF, by 1 to 3 years, we hope to see implementation of reforms and then some improvements in service delivery. And by 3 or more years, that's where we'd hope to see improvements in RMN-CHN. That's child, neonatal, maternal mortality improvements, for example. And it's important to note that as part of this, the GFF really has a contribution perspective. So that is to say that countries really are the ones that form and shape their own plans for RMN-CHN. So the impacts achieved really belong to those countries who are very much in the lead during this partnership. Next slide, please. So given that these processes are at the country and the portfolio levels, the GFF needed a measurement framework to actually see how we're doing across various levels. So the purpose of the GFF's measurement framework is really to use data and evidence for strategic planning and improvement in RMN-CHN. So we really build on the country data systems and capacities, and then focus primarily on using that routine monitoring data for understanding and course correcting the implementation of RMN-CHN programs over time. And then building on that routine monitoring data, we do periodic synthesis and review approximately annually together with the countries to look and see how progress is going. And then periodic evaluation and implementation research that draws on a variety of data sources to align activities with systems and better understand how we can improve going forward. And throughout each of these levels, the GFF is really looking to reinforce and strengthen existing country data systems and build capacity for data use and decision-making in these areas. Next slide, please. Okay, so how do we bring all of these things together in the GFF data portal? So data comes in at various streams for each country as part of an annual data process. So on the left under data collection, you'll see several areas that are really global data sources. So we build for each country on data sources such as the district health surveys, mix, other population-based surveys, other globally available health financing, resource mapping, and World Bank data. So all of that comes in annually. into the system. And then below that, you'll see a very small stylized framework. And that is to represent how the countries themselves actually develop a specific framework that's a results framework for measuring RMNCH in their countries. And that is to say that each country reports on its own set of indicators. So you have those globally available sources and then the country-specific data that all comes into the repository. It's processed there in the repository. So data is cleaned, stored, calculated. We do certain calculations that are necessary for each country's measurement. And then finally, we do visualize the data on the portal. And that can be used then for country analysis, donor reporting, and analytic products. Something that's important to mention is that no data is then published live on the site until it has been formally approved by the country as the data that was submitted. And so the country goes through that process of review, usually at the MOH, to ensure that what's being reported is what was sent. Next slide, please. So just as a final reframing of what data appears in the portal, because there's a lot, we have several data sources, and you can see here how frequently they're seen. So we really rely a lot on DHS and other health surveys, quite a bit of global health expenditure database and resource mapping data. We have a quarterly review from the GFF focal points on how countries are doing as part of their process. World Bank data, and then really this implementation progress data from the countries is the meat of the portal, and that's measuring data linked to those country-specific areas. So I'm going to go ahead now and share my screen so that we can take a dive into the portal. All right. So here's the GFF data portal. I'm going to start briefly with the homepage, and then we'll jump into a country to take a closer look. So on the GFF portal, because this is a cross-cutting area, we do have all of the components of RMNCHN here on the global map, where you can see for the 36 GFF partner countries what data is available and how countries are doing. So you can see, for example, DRC here had its most recent survey in 2017, compared to other countries that might have had a more recent survey like Kenya, where the latest DHS was in 2022. We take whatever population-based survey was latest for all the countries, and then you can see how they're doing across all areas of RMNCHN. So that's pretty fun to explore. All the data in the portal, of course, can be downloaded directly to Excel, along with the data sources that are used for each country. So I invite you to explore that further. We have that same logic model here, and it's a little bit more interactive on the portal. You can click in and see which of the 36 GFF countries have been improving for 1 or more years or 3 or more years, and then go directly to those country pages from here. Finally, you can see a little bit of how we measure progress for ourselves as the GFF here, both for some of those more standard indicators that we expect across all of our countries, like a completed investment case, to medium-term outcomes, like measurements of quality of service delivery, which has been improving a lot in the countries, to longer-term outcomes, including health financing measures and how countries are doing across the majority of their MNH family planning indicators, for example. And you can hover over these to see which countries over time have actually been improving in these areas. So definitely a fun place to explore. Just in the interest of time, I'm going to jump to a country so we can take a look at what exists there. So you can see we have all the GFF partner countries that are listed here. I'm going to just click into Rwanda to jump through a few of the areas that are on here, just so you can see what's here. So we start with some basic background information about each country's partnership with the GFF. So we have when they joined the GFF and their investment case timeframe for RMNCHN. So Rwanda makes a good case because it's coming up on the end of its IC timeline. And you can, of course, click here to see more about what's included in the investment case and the project documents. That takes you to the GFF main website for Rwanda. The GFF does co-finance with the World Bank. So there are 2 projects that are currently active in Rwanda, and you can see them and their amounts here. So just some background information. Now, going kind of through the logic model and what's here, we do use the DHS data to look across the impact indicators. So maternal mortality, under 5, neonatal, and you can see that Rwanda has been improving in all of these areas between its most 2 recent population-based surveys. And you see all of these have sources here, Now, we do use the population-based surveys because it's a measure that is used also in most of our countries. But of course, we recognize that a lot of global partners use estimates or other data. And so we do link to several of these areas here, whether it's WHO, childmortality.org, World Bank data. So a lot of that is here just in certain areas where we know that estimates are also very pertinent for measuring these areas. The GFF is very focused on health financing indicators, especially government budget to health, health budget execution, et cetera. So these areas we report on for all countries. These are indicators that usually are pulled from the Global Health Expenditure database, but then also some come from the countries themselves. And this can also be downloaded. So next we have coverage-based data that this also comes from the DHS. Usually, of course, all of our sources are always listed here. And this is really interesting because you can see that there's a pretty wide range of how the country is doing based on the indicator. Some are improving quite dramatically. Looks like PNC has gone way up in Rwanda, whereas others are stagnating, like exclusive breastfeeding. It's important to note that this is the population-based survey coverage, but also the GFF is working with countries in collaboration with Countdown to 2030 on analysis workshops to get a better sense of how to use the facility data to estimate coverage of key service delivery indicators that can be used more routinely. So you can see some of that data over on the Countdown to 2030 website here, and the 2023 report is forthcoming. Usually we have a description of resource mapping for each country, and that gives a lot more information about which partners are contributing to the budget for each country. Now we have a little bit more about what each country is doing through the GFF process, investment case, routine analysis available. Rwanda's been implementing for a while, so it's doing well in those areas. I'm gonna just skip down here so we can get a better sense of what's going on in the country. So here we have the interactive theory of change, and this is specific to the Rwanda engagement with the GFF. So this is where we get our country-specific indicators. We start with each reform that the country has as part of its collaboration with the GFF. So we have a big focus on use of data for decision-making. We have quite a bit here on efficiency and sustainability for financing. And I'm gonna just take a quick look here on strengthening of the delivery system. So you can see we have output, outcome, and impact indicators that all relate to this area. So it makes for kind of an interesting set of indicators. You can see that some of them we can click into, whereas some we cannot, and that is indicative of looking at the data. So I'm just gonna see if I can click on an indicator here and look at a time trend. So here we can see a map of the country, and we can see for children age 6 through 59 months who undergo mid-upper arm circumference screening. So that's going to be a measure of nutrition by community health workers. And this is an area that's very important for the country at this time. There's a couple things we notice. One, this is coming from facility data. This is the routine monitoring system. And two, we can see how we're doing in certain areas that are being supported by the project. And we can see that there's been quite a lot of progress if we click into some of these areas, even just in the past year. We can expand and look at this either as a chart or as a table, so we can see the exact data that's been reported by the countries. And of course, this is always downloadable to Excel. So that's definitely of interest. We can also click here and see the various data separated by programmatic area. So for example, we could look at family planning and see new users of modern methods. I can always reset my filters to get a sense of the national value, or click into the map to look at the various areas. And here, sometimes depending on what's been reported, we can actually disaggregate to see various different types of modern methods that are used. So I'm going to just quickly look at an immunization indicator to look at Penta for a quick moment here, just before, if I have a few more minutes. And we can see that actually immunization has been not increasing as quickly as maybe we might like. So we can take a look and see how we're doing in different time periods. So for example, before the COVID time period, we were pretty
Jess, sorry
even.
to interrupt you. Is this your last, just
It
so
is.
that we can keep to time? Wonderful.
It's my
Great.
last one. Thanks.
Perfect.
We can look at that pre-COVID time period and then, for example, look after and see that it did kind of go down right after that time. But in the past 1 year has been coming up, and we can see how that looks subnationally. So I just invite you to take a look, explore, and see how that's been going for various time periods for different countries, and then get a sense of what might be working and why. There are a few other areas that I won't jump into right now, including some fun new features and comparing key themes, but I'll pause in the interest of time and come back to that in the Q&A if applicable. Thanks, everyone.
Wonderful. Thank you so much, Jess, for that great overview of the GFF data portal. It's great to be moving from the IA 2030 that really goes into detail in one specific programmatic area that's very complex in and of itself, to having the chance to see the GFF data portal that is comprehensive across the continuum of care for women, children, and adolescent health. And again, similar to the IA 2030 platform, has both sort of the overall summary kinds of measures that you can see, sort of global progress, and then all of the interactive features you just showed about the country-specific data that is really rich. So thank you so much for sharing that with us. I would like now to move over to our third presentation that will be by Dr. Kain So. This is another platform that is covering the continuum of care for women, children, and adolescent health. So first, I'd like to introduce Kang. Kang is a public health professional who specializes in monitoring and evaluation. His specific focus is on health information systems and health system strengthening, and also an expertise. He has expertise in primary health care as well as in maternal, newborn, child, and adolescent health. He is currently a health information management specialist at UNICEF headquarters, and he has in the past worked at the country level in Kenya, Eritrea, and Myanmar. So with that, I would like to hand it over to Kang, who's going to walk us through the Countdown to 2030 profile. Thank you so much. Over to you.
Thank you, Jennifer. I thank you very much. I would like to speak about the Countdown 2030 profile, and on behalf of the Countdown 2030 profile development team. And here's the outline of my presentation. I'll be talking about what is the Countdown 2030 country profile, and how the Countdown profile are developed, and what are the contents of each country profile page, and how can the country profile be used, and what are the Countdown 2030 regional profiles. So basically, we have country profile and regional profile, and I'll be giving an overview of both profiles. Next, please. The Countdown 2030 national profile, the main purpose is serving as a tool to promote data use to improve women, maternal, newborn, children, and adolescent health. The very first Countdown country profile was launched in 2005. At that time, the focus was only for the child survival. And then over time, the profiles were launched every year or every other year based on the data availability, and then expanded to cover maternal, newborn, child, and adolescent survival, as well as the intervention coverages. And then the main and then it expands different areas like not only the survivor, but it expands to the intervention coverages. And next, please. And then here are the overview of the Countdown profile. For the country profile, there are total of 4 pages, and 3 main pages. The third pages is to expand the indicators and then present a more action-oriented visualization. And then there's a bonus page, which is the 4th page, which is the detail of the causes of death. And then there are 2 versions. We can download the Countdown 2030 profile as a PDF format. At the same time, we can go online and have an interactive visualization of the profiles. And then we use latest available data with the formalized and authorized by the countries. Uh, and then we focus on the continuum of care of the indicators. We cover the type of the information like demographics, coverage, equity, and then the focus is also on the continuum of care, different components of the RMCH care, and includes the environmental health indicators. In addition to the profile pages, there are the metadata and then data downloads functionality, as well as in the annexes, we put the different references and then the tutorial on the how to use the profiles. Next, please. Here are the sources of the data that we are using for the profiles. These are the national level, nationally representative surveys like DHS, MIX, and then UNICEF global databases, and then UN interagency group for child mortality estimation, and then UNICEF and WHO different databases, and so on and so forth. Next, please. And then let me go to the country profile first, and then I will present the regional profile. And then, as I said, there are 4 pages on the country profile. This is the first page. The first page covers the mortality situation of the country, like maternal mortality ratio, neonatal child adolescent mortality rates, and then the neonatal child adolescent causes of death, and then causes of death for the maternal mortality. So basically, basically it covers mortality situation, the trends, and the causes of death. And then another component is the intervention coverages for RMNCH in a way of continuum of care from the reproductive health to the adolescent health. And then the focus is also on the equity. We can include the comparison of the poorest 20% with the richest 20% for the each and every intervention coverage indicator, so that we can have a sense of the equity situation of this particular intervention coverage. And there's another indicator which is included is the composite coverage index, and then which is the composite indicator for the different key interventions related to RMNCH. And then we also have the demographics and context of the particular country, population, fertility, education attainment, ECD index, birth registration, and conflict barometer, which is the demographics and contextual information of the country. Next, please. For the second page, it is more in-depth snapshot of the different interventions. Very first top chart is related to the nutrition-related indicators, which give the overview of the nutritional status of women and children, and the interventions related to nutrition and breastfeeding practices. And then it is followed by the coverage for interventions for specific components of the continuum. Here, the focus is the trend, more on the comparison of this indicator over time, and maternal and newborn health related interventions, child and adolescent health related interventions, and then coverage of the environmental interventions, particularly for the water, sanitation, and hygiene coverage indicators, and then additional equity indicators where possible we make a comparison of poorest 20% against the richest 20% to see the equity situation of the country. And then next, please. On the third page, the focus here is on the health systems, policies, and health financing situation, which are actually the key drivers of the coverage. We summarize here on the third page, like legislative policies of the country on different RMCH issues, such as family planning, maternity protection, international code of breast milk substitutes, abortion, and highlighting what are the country's status in terms of these RMCH related policies, and the governance, like costed RMCH plans are in place or not, and the maternal new maternal and new MPDS, maternal and perinatal death surveillance review is in place or not, and the service delivery situation like health, human health workforce situation, and the financing situation, the government expenditure, and ODA. And there are other extra information, including the explanation of the acronyms and SDG 3 targets for the RMCH indicators. The next, please. Fourth page is actually the bonus page. That chart, a smaller version of that chart is included in on the first page, but here is the elaborative explanation of that chart to improve to provide information which is useful for interpreting the intervention coverage measures and identifying the program priorities. And then let me next, please. Next, please. As I said, there are two features. One feature is like we can download Countdown profile as a PDF version and then use for the planning and advocacy. But at the same time, we can go online, Countdown 2030 dashboard, and where we can do the interactive function and hovering the like for example, we can hover over the indicator, and then we can see the metadata of that particular indicator definition, what is the numerator, what is the denominator, and what are the data sources, and so on. Next, please. Next, please. Next, please. These are the like hovering function. And here's the summary of how we can use the profiles for planning, advocacy, and accountability. And then we can use the profiles for the strategic planning and the advocacy for the health intervention and accountability purposes. And next, please. I would just go through the overview of the regional profile. The regional profile, well, is the benefit of regional profile is that we can see the aggregate data of the regions, as well as we can make a comparison of the regional data against different countries in the region. Then that is the main feature of the regional profile. Next, please. Like this is just an overview of the regional profile, and you can go to online and see the regional profile. As I said, next please, because for the time interest, let me go through a little bit quickly, but I just wanted to explain. Yes, here in the regional profile, you can see like regional view as well as the country view. So regional view is just the aggregate the aggregate data of the indicator, where we can see like for example maternal mortality. What is the maternal mortality situation in the region aggregated from the different data points from the different countries included in this region. And at the same time, we can expand that information into different countries and then make a comparison of different data points from the countries in a single chart. And then we can make a benchmarking of how is that country particularly performing vis-a-vis other countries in the region or the region aggregate data. And then with this, let me conclude my presentation for the sake of time interest. But you can go through online and you can see the detail of the Countdown dashboard for both country level profile and regional profile. And then you can also see the brief tutorial there where you can explore how to interpret or how to use the profile for your different planning, monitoring, evaluation, advocacy purposes. Thank you very much.
Thank you so much, Kaing. That was an excellent overview of both the Countdown country profile and the regional profiles. I know this is the first round of the regional profiles, and so appreciate the thought that's gone into combining in one place all of the policy, coverage, equity, systems, financing data in one place, and the ability with that regional profile to compare progress across countries in the region, and great for planning and advocacy purposes. So thank you so much. I would now like to turn us over to Dr. Helen Chieri, who is going to give us some reflections from a country perspective on the utility of the 3 different data platforms that have been presented to you all today. So before I turn it over to Helen, I'd just like to introduce her to you all. Dr. Chieri is a health systems and monitoring and evaluation expert, currently working to improve and streamline monitoring and evaluation in the Kenyan Ministry of Health. Dr. Chieri has wide experience in implementing initiatives that enhance availability of quality health data in Kenya as well as in other developing countries. She has a particular interest in strengthening measurement mechanisms for primary healthcare using available tools such as the vital signs profiles. And we will also want to hear from her now on her thoughts on these 3 different platforms for usefulness for country planning purposes and other uses at the country level. Thank you so much, Helen. Over to you.
Okay, thank you. Thank you, Jennifer. Good morning, good afternoon, good evening, everyone. First, I want to really congratulate the 3 teams that have presented. These are really amazing tools that I think will be taken through, albeit quite fast. But that these tools are really robust tools that make really good use of existing data. I think right now we have a lot of very, very high quality data for many countries, from the DHS, our routine health information systems, our facility assessments, and other sources of data. So I think all the tools really have come up with very innovative and very useful ways to combine this data to put this data together in a way that it allows for a lot of value gain from the data. So just maybe touching on the vaccine immunization scorecard, I think we have seen that we're able to track the 0-dose children, which of course is really key indicator to track in this era of SDGs and leaving no one behind. So just saying that we're able to track even performance over time. You're able to see how did you perform during the COVID pandemic? Are there still areas that we are lagging behind? And I think the tool really has a robust way of unmasking differences in the different vaccines or all that within the country. So I think this is a very useful way that the team has come up with putting this data together. And I think also the whole idea of country comparison with the region and as well as other countries is very, very useful. The GFF portal, I'm happy to see this because we've been giving quite a bit of data, and it's good to see how useful this data is. And I think this is a tool also that really facilitates country profiles in a very, very useful way, showing out performance on RMSH, bringing in financing issues, and also other contextual issues such as whether or not the legislation is there, whether we have policies and all that. So I think this is the GFF portal is actually vast, and I think again issues of equity comparisons again with the countdown the countdown work in general, I think is extremely useful, especially for maternal and child health. We're able to interact with these profiles. We can narrow down to country profiles. We can look at, and I like the fact that the tool has a page that allows for action, taking action or tracking actions. Again, bringing in context legislation and other issues. I think these are really useful threads that each of the tools is bringing. These tools, I see them being very useful both at the global level to help partners use data that is really high quality, so that partners, civil society, and other stakeholders are able to performance of country, even by subnational regions, as well as in comparison with regions and other countries, and maybe is needed or the areas where there is most gap. And then for governments like the ministries of health, I think these are tools we are specifically going to use in Kenya in terms of our own reports. The fact that we can all these tools really for of the tools because of these tools and put it in the report, and we are sure that and you can be sure that that is the source is the sources. So by combining them and putting these visualizations, I think these are tools that are really going to be useful for countries in terms of strategic planning, reporting, whether it's programmatic reporting or just national level reporting, even putting these are tools that are going to be extremely useful. And I want to really thank all the everyone who has put effort towards putting these tools together. Are still develop as they become. So that is what I can say in terms
Wonderful.
of the three tools. Thank you so much.
Thank you so much, Helen. It's great to hear from the country perspective the usefulness of these platforms to help countries with their decision making and resource allocation for women, children, and adolescent health. So thank you so much for your remarks. I realize we're running out of time, and so I'm going to move us to our closing remarks. I have the privilege of being able to introduce Dr. Chizoba Barbara Wonandi. She is an associate scientist at the IVAC Center at Johns Hopkins University. She is also the country director of the school's International Vaccine Access Center. And she has a very illustrative career of working in public health. She has over 30 years of experience in public health and is also a public health physician with a lot of expertise in immunization program delivery. So with that, and to just help us wrap up, I'd like to hand it over to you, Chizoba. Thank you so much. Over to you.
Thank you very much. I think this has been an excellent session. We've heard from UNICEF on the countdown, from the IA 2030 Immunization Agenda Scorecard, and from the Global Financing Facility. So we've seen the demonstration of these data visualization platforms, which are digital tools that are designed to provide policymakers, researchers, advocates, society organizations, journalists, and general public critical data that will support decision-making and advocacy to advance the health of women, children, adolescents, and adults globally. And it was also very interesting to hear from our colleague from Kenya, who highlighted the attractive features that these digital tools carry with them, and also how she finds them valuable and from a country perspective in being able to use the data for decision making. So she's done an excellent job with identifying those features that the presenters did a fabulous job of showcasing. I would say that amongst the three dashboards, If you are looking to make a quick presentation, if you are even looking to write a proposal, you don't have to dig very far. I learned a lot from the demonstration of both the countdown and the Global Health Financing Facility. I think one of the really attractive feature is having all those data in one place. Another thing is the data visualization that has been shown here is really grounded on global strategies and global goals, as well as the theory of change at the country level. So this is data that is showing countries and the regions and the global level exactly what they need to do to make advances in the strategies that they've put together. And finally, I would say that I really appreciated the IA 2030 scorecard because it goes deep into a particular area, immunization, and helps us translate the IA 2030 agenda and the vision in terms of data and visualization. So as they say, pictures speak louder than words. So I would encourage everyone here who has been listening, and even also the presenters, to go to these websites, explore them, look at them, use them, cite them. And then also, I would also encourage the organizers as well as the hosts of these platforms to put in some kind of feature for feedback from users, because it would really be nice to understand exactly how the data and the tools provided by these platforms are being used for decision making and advocacy, so that we can continue to iterate on them and make them better. But all in all, for me, this has been an exciting morning to look at these data platforms, and I am definitely going to go back to these platforms and explore the data and use them for my work. So thank you once again for the organizers. This has been a fabulous session. I wish you all a wonderful rest of the week, and thank you to the participants for being here.